Hi, I'm Dr. Bill Lyle and I practice obstetrics and gynecology. Floridians Protecting Freedom. Have you heard of it? Well, you need to become more aware of it because it has nothing to do with protection. It has nothing to do with freedom. In fact, if they wanted to really use the name of what it actually does, they would have to call it killing patients in the womb, because Floridians Protecting Freedom is a ballot initiative that has now obtained over 910,000 signatures to be on the ballot to change the Constitution in the state of Florida, codifying abortion here in the state of Florida. We have done our best to decrease the gestational age for a legal abortion in Florida from 24 weeks to 15 weeks and then down to 6 weeks, while Planned Parenthood and the ACLU of Florida are trying to bring back abortion. Abortion is evil. It is taking the life of a baby in the womb, babies that we treat as patients in the womb. It will be on the ballot in November, and it needs 60% of the vote in order to pass and become a constitutional amendment. The state attorney general of Florida has asked the Floridian Supreme Court to look at this because there are some real questions when it comes to the language. First, is it deceptive to call it Floridians Protecting Freedom when it's really an abortion constitutional amendment here in Florida? Absolutely, that is deceptive. But it's also deceptive, and the terminology is not known as far as defining healthcare provider and health. The Florida Department of Health, through which I am licensed, all the physicians, all the nurses, also manages other forms of care. Did you know that a healthcare provider under the Department of Health of Florida is also included as a septic tank contractor? Do you know it also includes a tattoo artist? Do we want these hardworking people to be deciding what is right when it comes to taking the life of a baby in the womb? Absolutely not. So number one, we need to fight that this does not get onto the ballot. But if it does get onto the ballot, we need to come out in force. They need 60% to codify abortion here in the state of Florida, and we will not stand for that. Florida is leading the way in the United States as far as how we treat the babies in the womb as patients. We have centers all across the country, maternal fetal medicine specialists that look at the baby, the fetus, the little one, as a patient. They are not just diagnosing these babies in the womb, they are treating and they are curing these babies. We routinely are doing life-saving blood transfusions to babies in the womb to save their lives. We have done this at my hospital as early as 18 weeks gestation. Blood that you might have donated at your local Red Cross center is being used, transfused directly into the vasculature of a baby in the womb to save their life a month and a half before they can even begin to survive on the outside. A patient is a person, no matter how small, and patients have rights. In centers around the country, they are now doing open heart surgery on babies in the womb, spina bifida corrective surgery, laser vascular surgery, and even brain surgery to diagnose, treat, and cure babies in the womb. They are patients and they have rights. We need to fight the Floridians Protecting Freedom, which is going to be on our ballot. We need to stand up for our most vulnerable because Floridians, that is the right thing to do. And we know we need to do the right thing and defend the least of these. I'm Dr. Bill Lyle. I practice obstetrics and gynecology, and I'm the founder of ProLifeDoc.org. Please share these comments with your other pro-life friends. Get your church involved. Other than sharing the healing message of the gospel, I can't think of anything that the church needs to be more engaged in defending the lives of God's preborn, created in His image at the moment of conception. These moms need help. They need healing, and we are here to help. God bless you all, and stand up for what is right here in the United States.